you're looking at a ghost. Statistically speaking, I should be dead by now. I was diagnosed with breast cancer 9 years ago, with liver metastases 7 years ago. Prognosis with that is 1 to 2 years. Why aren't I dead yet? Maybe because of good drugs, a good oncologist, good surgeons, and just good luck. Maybe because I'm a physician, I make better treatment decisions. Maybe because I'm young, I'm more aggressive and I think outside the box. Because I'm a physician, here's how I got my diagnosis. The surgeon called me on a Friday night at 6 p.m., which is not a good sign. He says, "You have invasive ductal carcinoma." I said, "In situ?" He said, "No." I said, "But that's cancer." He said, "Yes." I said, "Well, maybe they got the wrong slides. They put my name on the wrong sample." He said, "No. You have invasive ductal carcinoma, not in situ." I cried for the next 2 hours on a plane. When my friend picked me up at the airport, she said, "What's wrong? What did he do?" assuming I was crying over boy problems. I said it for the first time. I have cancer. Early in my cancer journey, I joined a support group called Bay Area Young Survivors, or BAYS, for young women with breast cancer diagnosed under age 45. I was 32. BAYS has a subgroup for metastatic women called METS in the City. I've learned immeasurably from these women. We share our frustrations, our fears, anger, side effects, the most intimate details. We also share our deaths. Since I joined the group, over 20 women have died. But they're not just a number. They're my friends. Courtney, Erin, Elizabeth, Tara, Sarah, Felicia, Melissa. As they walked with me, as I walked with them, so others walk with me, this path of progressing disease, more horrifying treatments, and inevitable death. We help each other to live while we die. One truth about metastatic cancer is that you will always and forever be in treatment. You ride one drug as long as it works, and when your cancer progresses, you go on to the next drug. Eventually, you run out of options. In my case, it will be liver failure, and then you die. I have to think about quality versus quantity of life. So far, I have not had a single symptom from my cancer. All of my pain and suffering have come from chemo, surgery, and radiation. It's hard to accept as an outwardly healthy, fit person that I have to take this chemo or lay down for that surgery. Is it worth it? So far, yes. But there will come a point when I would rather suffer less and enjoy the days I have. A year and a half ago, the cancer came back in my liver with a vengeance. The pathology said at least 15 tumors. I tried a targeted procedure called radioembolization to my liver. It's supposed to be an easy recovery, 1 to 2 weeks. My recovery was hell. I gained a new understanding of chronic pain, how it feels to crawl to the bathroom in the middle of the night for pain meds, to not know when the pain will end, tomorrow, the next day, ever. One day I felt better, so I got up and I went for a hike, only to come back in worse pain than ever, prolonging my own recovery by weeks. I'm a physician and a patient. It's a unique perspective. I have to advocate for myself and my friends going through similar circumstances. We have to educate ourselves because our doctors don't or won't. What is hospice? What is an advance directive? What is palliative care? What does the right to die law mean for us? When is treatment more harmful than helpful? On and on. Questions very few oncologists will answer. For me, knowing more about my disease and making plans about my choices is helpful and even comforting. As I was writing my advance directive using a helpful tool called the 5 Wishes, it asked where I wanted to be buried. I wanted to be by my parents, so I called my mom, who is the most organized person you've ever met. She has her will and advance directive and everything totally prepared, and her shoes lined up in color-coordinated rows in the closet. I asked Mom, where is she going to be buried, and is there room for me in a spot nearby? She said, well, I haven't exactly got a plot yet. And I said, what? Why not? Let's go shopping for graves. So I took Mom shopping for grave sites. It seemed strange, but we brought a picnic and we went and scouted our options. I love the place we chose. It's with the community I grew up in a beautiful cemetery with roses and fountains and views of the hills. In fact, I was hiking in those nearby hills, and I pointed to my friend, look, there's my cemetery. That's where I'm going to be. Is this creeping you out? You should know that it is so comforting for me to know where I'm going to be with my family and my community. My mom was creeped out also, but once we got our plots, she feels better too. It's all settled now, and we can live fully. And when we die, we won't be burdening our loved ones with difficult decisions to make while they're grieving. I had a PET scan last week. It shows worsening liver tumors and new tumors in my bones all over. The good news is I don't qualify for the targeted liver radiation that I had that was such torture. The obvious news is that my cancer is out of control. It feels like I'm on a roller coaster, and I'm cresting the top, and I'm about to hurtle down, and I am screaming, here we go. Life is terminal. What we can do is live well while we're dying, accepting that death is coming, maybe sooner for me than others my age, isn't being negative or pessimistic. It's real. Death is considered a failure in Western culture and medicine. As physicians, we're taught that if someone dies, it's because something went wrong. We don't want to accept the fact that everybody dies. It's not a failure. People who sign up for hospice when they're given 3 to 6 months to live actually live 1 to 2 months longer. But people think hospice is giving up, stopping the fight, losing hope. Not true. Hospice helps manage your symptoms and relieves your loved ones from physically taking care of you, allowing you to be present for them emotionally. There's so much we can do to improve on end of life. Firstly, we need to talk about it, make the discussion open and not so taboo. Talk with our loved ones and our doctors. We all need advance directives to express our wishes when we can't speak for ourselves. How do you want to be treated in your final months? How can we innovate in dying? Yes, we are living better, healthier, longer, thanks to all the work that's being done. But even if you're still jogging at 100 or still jogging at 200, you're still going to die. If you knew when you were going to die, knew exactly how much time you had left, how would you live? What would you do the same or differently? I'll leave you with a little poem I wrote. In a hurry. I want to see, touch, do, taste, smell, feel everything. Walk the earth, climb the mountains, and snowboard down. I want to try everything at least once. Lots to do, I'm in a hurry, not much time left. How long before the cancer makes it impossible, narrows my world to just my room, my doctor's office, the hospital? I don't know. I can't know. Time wasted planning for a future I don't have, working to save for a family I will never have. No more. I'm here now to experience everything, to dance and laugh and sing around the world and at home. But I can't do it all. No lifetime is enough to experience everything. I will see, touch, do, taste, smell, feel everything I can in my life, however long or short it may be. And it will be enough. Thank you.